Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Rishika Barua. Our top focus story is a study of 31,600 vaccinated healthcare workers that was carried out at the Apollo hospitals across the country. This study found that less than 5% people were infected with COVID post-vaccination. A small 0.28% needed hospitalization, and there were no deaths reported among these 31,600 people. Now, it's important to note here that this study has not yet been peer-reviewed, but the data overwhelmingly points to the fact that there was 95% protection that was given from getting the COVID-19 infection and 100% protection from mortality due to COVID. Now, one of the key authors of this study, Dr. Raju Vaishya, joins us on the show today. He's also the Senior Consultant Orthopedic and Joint Replacement Surgeon at the Apollo Hospital. Thanks so much, Doctor, for being with us. This is a fascinating study. Of course, like we pointed out to our viewers, the study hasn't been peer-reviewed yet, but the data is very encouraging. What more can you tell us?
This is one of the largest study on the healthcare workers, more than 31,000, across 43 hospitals all over India from all regions. That makes it more important. This study also is unique because most of it was done during the second peak of the COVID-19. There were tremendous increase in the number of cases, mortality and morbidity. So what we found that vaccine not only prevents infection in our healthcare workers, but also protected them from having severe disease. Only 90 out of more than 31,000 healthcare workers acquired infection, and only 90 of them required admission in the hospital, that too for minor disease, which was recovered fully and there were no deaths.
Right.
So this points very clearly that vaccine is not only preventive, but it is also protective. And we studied both types of vaccine which were available, that is Covishield and Covaxin, and found similar efficacy. So my request to all the public is that don't delay your vaccination.
Yes.
Whichever vaccine is available, you should go for it as early as possible.
Right. Dr. Raju Vaishya, the other important question is, the fact that a combination of both vaccines were given, but more number of subjects, almost 90% received the Covishield vaccine. And this is a mixed study, right? You studied subjects who were given a single shot of the vaccine as well as both shots. What was the difference that you found?
Actually, some of the patients who were, or healthcare workers who were included in the study, at the time of study could only have one shot of vaccination and waiting for the second one. So we did not ask them to wait for the second one, but because of the timing, they only had one. So we found there is slight increase in the infection rate in people who had only one dose compared to who have both the doses of vaccination. So this means that two vaccination is better than one vaccination, but one vaccination again is sufficient enough to protect you from severe disease and acquiring infection.
Right. The other interesting aspect of this study, is the fact that maximum infections occurred in the second wave between April and May 2021. This obviously goes to talk once again about the severity of the second wave. What more have you understood about the Delta variant, for instance, through this study of yours?
We did a pilot study on 69 healthcare workers of Delhi hospital and found that 47% of these healthcare workers had infection with Delta variant. And recently we have also, with the help of NCDC Delhi, have analyzed our patients and found that now this Delta variant has increased to almost 75% in our healthcare workers who were infected. So although Delta variant is highly virulent and causes severe disease, but our healthcare workers were protected because they had vaccination. Otherwise, there could have been more serious disease in them.
Right. So what you're essentially saying is very interesting, because you're saying that a majority of these infections that you studied in over 31,000 participants occurred in the second wave, and a majority of them were actually Delta variant. But that does in fact indicate, and of course this has to be peer reviewed, but prima facie it indicates that both our vaccines do work in granting a certain level of protection against the Delta variant.
Absolutely.
All right. Well, thank you so much, Dr. Raju, for joining us on the broadcast. It's a fascinating study, the largest of its kind in the country. And what it says overwhelmingly is that vaccines work. Of course, the peer review of the study is yet to happen, but we'll keep a close watch. Thanks so much for joining us.
Thank you very much.
Now, a lot of us who've actually got the COVID-19 vaccine are curious to know just how protected we are. How do we know if the vaccine is actually working? Do we need an antibody test? Should we even be getting an antibody test after we've been vaccinated? And is the antibody test the best way to gauge protection? To answer some of these questions and to understand how vaccine immunity works, we have Dr. Monica Gandhi joining us from San Francisco. She's Professor of Medicine at UCSF. Thanks so much, Dr. Gandhi, for being with us. I want to begin by asking you to help us understand how vaccine immunity works. Should we get an antibody test after we've got vaccinated? How long after you've got vaccinated should you get this test, and what should you be looking for?
You know, we don't actually recommend an antibody test after the vaccine to confirm you're immune. And I'll explain that there are two types of responses that develop after you've had a vaccine. Actually, this is true if you've had natural infection as well. You get antibody responses, which is a protein in the bloodstream. And you also get T cell responses, which are cells that are very difficult to measure because they require a research laboratory. The antibodies will actually fade over time. That's not abnormal. That's actually a normal part of our immune system, because if we had antibodies in our bloodstream for every infection we've seen, our bloodstream would literally become too thick. So those antibodies go away, but the T cells and also what are called B cells, which are parent cells that produce antibodies, they will be able to, if they see the virus again, reactivate and make new antibodies to fight that virus. So the reason that we shouldn't measure antibodies after the vaccine and worry about it is the antibodies could go down after, say, a month, 3 months. It depends on who you are. Right. But it doesn't mean you're not immune to the virus from the B and the T cells.
Very interesting. So the antibody test not necessarily the only indicator of vaccine-induced immunity, but should immunocompromised individuals, high-risk priority groups, should they get an antibody test done so that they can determine if and when they need a booster shot of the vaccine for better protection, Dr. Gandhi?
So there are three options with those who are immunocompromised. One is to remember again that even if your antibodies don't come up, because we have redundant elements of the immune system, your T cells may be just fine, but it's very difficult to measure T cells. And so some doctors will tell you, well, measure your antibodies, and if you don't have them, then you need a booster. That doesn't, unfortunately, tell us about the richness of the immune system, that your T cells might be just fine. I will tell you that there are studies ongoing, including two studies that are large and ongoing at the NIH here in the U.S. to examine that very question you asked. Do you need a booster if you're immunocompromised, say a third shot in 6 months, say a third shot in the future? Because there are other vaccine-preventable diseases where we do give boosters for those who are immunocompromised. But the answer is yet not there, because, and it will probably take maybe 3 or 4 more months to have the answer to that question. So try not to worry too much, in the sense that hopefully you have redundant immune responses from your other arm of the immune system. Don't check antibodies. It still isn't recommended because it'll make you worry unnecessarily. And let's wait for the studies to determine if you need a booster.
Okay. So studies need to be done to determine if we need a booster, and don't get that antibody test because it will leave you more confused. But why do some people have more antibodies compared to others after vaccination? One can understand this if it's, natural antibodies that have happened after an infection, because people have different types and varying degrees of severity from COVID-19. But why do antibodies vary after vaccination?
It's a great question, and it really depends on everyone's individual immune response. The thing about trying to do some one-size-fits-all approach to how we monitor vaccine effectiveness is that your B cells, which are the progenitors of antibodies, they're the parent cells that make antibodies, may be more or less responsive to produce a certain antibody titer in your bloodstream, but it doesn't mean that your B cells aren't being produced. A good example, for example, is there was a study from the UK that showed that after mRNA vaccination, your antibodies were all over the place, like you just said. Some had high, some had low, but they actually biopsied the lymph nodes of these individuals after mRNA biopsy, after mRNA vaccination, and found that their lymph nodes had all formed B cells. There wasn't a single individual who had not formed B cells, which will produce antibodies in greater amounts if they see the virus in the future.
Right.
So it's really inter-individual differences in the immune system. It's been expected. There are some people who form a lot of antibodies to colds when they get a cold, and a lot of people who don't form so many antibodies. It's just differences in our immune systems, but it doesn't mean you're not protected. And that is very key here. You are protected. The majority of individuals after mRNA vaccination and other vaccines are protected, which is why breakthroughs are quite rare.
All right. What more is known, though, about, vaccine-induced immunity or natural immunity? How long will it last? Are we any closer to answering those questions?
So there's a lot of data coming out that natural immunity is quite durable. And the reason that we needed to wait till this time for that data to come out is COVID hasn't been around that long. So you have to see 8 months, 10 months, 12 months, and see if natural immunity is still durable. The studies are looking very good, meaning natural immunity is strong to COVID-19 if you get it in the past. That is also expected in the sense that cousins of this virus, like the SARS pandemic in 2003, still people are immune 17 years later in 2021. However, the question on the table for me is whether someone who is naturally immune would benefit from getting a dose of vaccine.
Right.
And when the virus is still circulating, which it very much is, unfortunately, my recommendation, a lot of people are going this way, France has actually made this decision, is to get one dose. You don't have to get 2 doses, but 1 dose of the vaccine after natural infection. Because what that will do is while the virus is still circulating, you do want your antibodies higher because those antibodies go into your nose and they prevent you from even getting a mild infection. Because what happens is your T cells are strong, they protect you from severe infection, but we don't even want to get a little bit of virus in our nose. So that's my recommendation. A lot of immunologists are going that way, but do be reassured that if you've had natural infection, you're very likely to be immune.
All right. Well, Dr. Gandhi, thanks so much for joining us. Those are some very important answers that you've given, especially at a time when a lot of people here in India are wondering whether they need to get antibodies tested after the vaccination. So no need for that is what you're essentially saying. Let's now shift our focus and look at what's happening in the UK and Europe, because UK is seeing possible onset of a third wave of COVID. The country is even delayed, remember, lifting coronavirus restrictions, mainly because of the Delta variant that is spreading quite rapidly. Germany, on the other hand, is seeing the lowest cases that it has in 9 months. Let's go across to DW's Emmanuel Chase, joining us from Berlin. Thanks for being with us. Possible onset of a third wave in the UK, is that the reason why, restrictions haven't been lifted, and how are people responding to this?
Well, June 21st was supposed to be the last day of social distancing and restrictions in the UK, and past that date, well, restaurants, venues, nightclubs would have reopened, but in light of the surge of infections, which are largely due to the Delta variant, well, Prime Minister Boris Johnson said that another month was necessary before easing those restrictions and going back to normal. Now, the initial date for the loosening of those restrictions was made back in February, and since the beginning of June, there's been a renewed increase increase of new daily cases that prompted that decision.
Right. Germany, on the other hand, has registered its lowest new daily coronavirus infections in nearly 9 months.
Well, here in Germany, the 7 days incidence rate has sunk to around 13 per 100,000 inhabitants. That's the lowest in months for Germany, and roughly half of the population now got at least one shot of the vaccine, with over a quarter of the people here in Germany being fully vaccinated. So for Health Minister Jens Spahn, this is now the time to ease some of the restrictions. For example, time to consider lifting the masks requirement outside and even inside in those of the regions where the incidence rate is very low. However, German Chancellor Angela Merkel also warned that the virus hasn't disappeared and that people should still proceed with caution as there are new variants around and as the race to vaccinate is still very much on. She did say, though, that all the efforts made in the past months have paid off.
All right. Thanks so much, Emmanuel Chase, for joining us with all those updates from Berlin. We'll keep a close watch on what's happening in the UK as well as other parts of Europe. Short break here, but we'll be joined by Dr. Grant on the other side to answer all your questions on the COVID-19 vaccine. Stay with us. Welcome back to our special campaign, Vaccinate India, in partnership with Google. We're discussing questions that you may be Googling about the COVID-19 vaccine. And to answer some of those questions, we have Dr. Parvez Grant, Managing Trustee, Chief Cardiologist, Grant Medical Foundation, Ruby Hall Clinic, Pune, joining us. Thanks so much, Doctor, for being with us. I want to begin by asking you about the effectiveness of the COVID-19 vaccine. More questions really being asked about this, given the fact that there are new mutant strains of COVID being found everywhere.
Well, that's a very interesting question that you have asked me. What I have found in Pune area is that the effectiveness of the Covishield vaccine is approximately 60 to 70%. And the Covax we are finding is around 85 to 90%. But Covax is not so easily available in Pune city because basically we have the Serum Institute, which is based in Pune.
Right.
So we are getting mostly the Covishield vaccine.
Right.
What I am finding is that after vaccinating these people with the Covishield vaccine, we are finding that some people can still get the infection. But very important is that once you're fully vaccinated, number one, nobody dies. You're vaccinated. Nobody goes on the ventilator. And the other very important thing is that you don't spread the virus to another person.
Right.
So this is very important in vaccinating people. Now, a little bit about Pune city, which is very interesting. About 6 weeks ago at Ruby Hall Clinic, we had 600 patients who were suffering from this virus.
Mm-hmm.
Today I was doing my statistics and we have only 16. So you can see there's a marked drop in cases in the city of Pune. You know, Pune used to be the world capital of Corona.
Yes.
Today I'm very, very happy that we have managed to conquer this very dreaded virus. So I think we are getting there, basically.
And I think what you're saying is very interesting, Dr. Grant, because you're essentially saying that even after both jabs of the vaccine, you could potentially get infected with COVID. But your chances of coming into a hospital, your chances of getting on a ventilator, getting severe disease are diminished. So you can't let your guard down, but you do have enhanced protection.
Absolutely correct. So the other very interesting thing is that since we have vaccinated, you know, when the first wave came, nearly 50% of my staff got infected, some infection or other. With this vaccination, hardly 1 or 2% of the staff, that is, we've got a staff of 4,500 people working at Ruby Hall Clinic, hospital. So there's a marked improvement even in the staff. So the staff are coming to work and everything is back to normal.
Right.
In fact, I'm very happy in the last 10 days, all the other specialties that we are running, like cardiac and cancer, and all started going up again.
Right.
And this is a marked improvement from what we saw 10 days ago. So I think slowly, at least I'm talking about Pune city now, we are definitely the war against the virus.
Yes.
My only problem is I hope we don't get a third wave, because otherwise we'll be back to square one.
Right. I also want to ask you, Dr. Grant, about the side effects of the vaccine, because there are certain side effects that are being reported. What are the most common side effects and what are the ones that you really need to be careful about?
See, what I have found in my experience, and I was just doing our homework, in the last 1 month, Ruby Hall Clinic has vaccinated 50,000 people. Now, the interesting thing about this vaccination is that people who are below 50 seem to get a much bigger side effect to the vaccine than those above 50. Those above 50 hardly get anything. That's because the immune system reacts in a different manner. So what we are finding that those people who are below the age of 50 seem to get fever. Some of them get a headache. Some of them get body ache. Most of the time it lasts for a day or two and then it goes away.
Right.
Major side effects have been seen at all amongst the 50,000 people we have vaccinated. In the elderly group, some people get occasional headache, no fever, no other side effect, and they go back to work. So I think this vaccination is very safe. It must be given to everybody. Now, as far as Pune city is concerned, we have managed to vaccinate 14% of our population.
Right.
Which is very small. Very small. We need to go up to at least 70%.
Right. All right, Dr. Grant, thanks so much. Those are very important clarifications that you've given about the COVID-19 vaccine. Thanks for joining us.
You're welcome. Thank you very much. Thank you.